So this is the manual muscle test for the Quadratus Lumborum muscle, which is a very large muscle in the lumbar region, right? And it's actually responsible for a lot, or involved in a lot of problems that people have involving their low back, especially that are involving the soft tissue. So this is a test that you really want to do for pretty much everybody that comes in with low back pain, because I guarantee you, I would say 75 to 85% of the time, it's going to test weak or it's going to elicit some kind of discomfort. Because as I said, it may not be the causative factor, but it may be a contributing factor to a lot of discomfort or soreness or pain that people experience in their low back. So what you want to do is you want to reveal the top of the iliac crest, and then you want to reveal so you can see the bottom of the rib cage, and I'll tell you why in a moment. So what you're going to do is you're going to bring your arm underneath the patient's legs. Your fingers or palm is going to be around gallbladder 39 area, and you're going to bring them into about 35 to 40 degrees of tilt, right, away from the midline. And then your supporting hand is going to be over the greater trochanter. And so the line of drive, and just let me move you, is going to be towards the midline, not past the midline, right? It's going to start out here, and you're going to bring both legs this way, and you're going to lift them off the table just a little bit, right? Not so maybe just like the heels aren't dragging so much. And so what you're watching for is when you're doing this test to look at the space between here. If it elongates a whole lot and it's weak, that tells me that the Quadratus Lumborum muscle is involved. Okay, so we'll start here. And again, some of you, it might be a little bit more difficult, so maybe you get a stool or something like that. You know, I'm a little taller, so I can reach over the table pretty easily. But some of you, you may even find it easier to do it lying on the floor if you have the ability to do that where you treat. All right. Again, you want to make sure that you don't hurt your back while you're testing their back. All right, so I'm going to be coming this way, and then you resist. And then ready, and resist, and resist, and resist. Okay. Now, very few people, except maybe bodybuilders or elite athletes, are going to be able to fully resist this motion, because this muscle is weak-ish on most of us because we spend so much time sitting, right? So we'll try it on the other side. Bringing the legs this way. All right, can I pull this down just a little bit? Okay, there we go. Okay, so again, putting your arms under here, supporting the greater trochanter, making sure you're comfortable, and I'm watching the space here. All right, and resist. Oops. Oops, let's tuck it under that way. There we go. And resist, and resist. Okay, so there's actually, thank you. So there's a little bit more movement on this side, so there's a little bit more space created for this side than that side. That side held pretty steady. So this is a way to test the Quadratus Lumborum muscle using this manual muscle test.